Can I go ahead, Ravi?
Yeah, go ahead, please.
Good evening, members, and I'm sure you all had a great Christmas weekend. Looking forward for the new year. And before I introduce today's moderator, I want to remind you that API has lined up a New Year Festival Gala on January 1st, Friday at 9 p.m. And I request all the members to join and enjoy the evening. And it's my distinct honor to introduce my alumni and current Vice President, Dr. Ravi Kohli. He is a board-certified psychiatrist and former assistant professor at University of Pittsburgh and West Virginia University. Currently, he is working as a director of outpatient program of SPHS. You see about 60,000 patients in various locations. And in addition to being a psychiatrist, he has additional qualification as addiction and forensic and geriatric psychiatry. He's also president of the Pittsburgh local chapter and ATMG USA and Ramkhana. And welcome, Ravi. And the other moderator doesn't need much introduction. Is well known to our members, Dr. Tarak Vaswada, the current board of trustees and also a medical director at Huntsville Hospital Behavioral Sciences and clinical professor of psychiatry at University of Alabama, Birmingham. Without further ado, I welcome both Dr. Ravi Kohli and Dr. Tarak Vaswada.
Thank you.
Good evening, gentlemen and ladies. It's my distinct honor to introduce to you one of the elite psychiatrists, not only in USA, I can probably say world-renowned. Dr. Dilip Jeste is a Senior Associate Dean of Healthy Living, Healthy Aging and Senior Care. He's also he's from UCSD, University of California, San Diego. He's a Distinguished Professor of Psychiatry and Neurosciences, Estelle and Edgar Levy Memorial Chair of Aging, Director of Sam and Rose Teen Institute of Research on Aging at UC San Diego. He's also co-director of UC San Diego IBM Center for Artificial Intelligence for Healthy Living. He has obtained his medical degree in Pune and trained in psychiatry in Mumbai. And then in United States, he did residency training in psychiatry at Cornell and the neurology residency at George Washington. Later, he was a research fellow at NIMH and became a chief of units of movement disorders and dementias there. And then he founded the San Diego University of San Diego's geriatric program. And he started the program from scratch and it became the world's largest geriatric psychiatry division. He has been a principal investigator in numerous NIMH-funded studies as well as VA grants. He has published over 12 books, 625 plus articles in peer-reviewed journals, plus 140 invited book chapters. And he had the honor of being the past president of American Psychiatric Association and American Association of Geriatric Psychiatry, the West Coast College of Biological Psychiatry, and the founding president of International College of Geriatric Psychoneuropharmacology. He's the past editor of chief editor of American Journal of Geriatric Psychiatry, and he was cited as one of the highly cited author in the Institute of Scientific Information. He was in the 0.5% of the people who were cited the most. So it is my honor to present to you Dr. Jeste. He's going to talk to you about the past year, what we've been through, the trials and tribulation, the triumphs, and all the things that we endured over the last year. Here is Dr. Jeste. The floor is yours, Dr. Jeste.
Thank you. Thank you, Sudhakar, Ravi, and Tarak for inviting me here. And good evening, everybody. It's really a pleasure to talk with all of you. Let me first share the screen. Can everyone see the slides?
Yes, sir.
Okay, great. Thank you. Okay. So, by the way, I should give credit to Ravi for coming up with this nice title, moving in from the year of fear to the year of being wiser. So 2020 was called the worst year in memory by the Time magazine. And we all will agree, there's no question about that with COVID, among many other things. And I'm glad it is ending tomorrow. And then hopefully the new year actually will be much better, much happier, and hopefully wiser. And with the vaccines being here, I think the end of the tunnel is indeed in sight. So I'm going to begin with this modern behavioral pandemic of loneliness, suicides, opioid use, then talk about wisdom as a unique personality trait. Does wisdom increase with aging? And finally, how do we increase wisdom? So when we talk about pandemic, of course, we think about COVID-19, but there have been pandemics for centuries. From the ancient times, there have been pandemics of plague, cholera, influenza, smallpox, and they have killed millions of people. But in recent decades, we managed to conquer them with development of antibiotics or antidotes or vaccines. What we are experiencing for the past couple of decades is a different kind of pandemic. These are modern behavioral pandemic. They're not caused by infectious agent like viruses or bacteria. They are caused by psychosocial factors. The most prominent among them is loneliness. And I will talk about loneliness in the next few slides. And loneliness also underlies suicidality as well as the opioid problem. Loneliness has been called a grand challenge to the society and a silent killer. Loneliness increases the odds of mortality by 30%. It is as dangerous to health as smoking 15 cigarettes a day and more dangerous than mild to moderate obesity. And look at this. This is according to the US Agency for Healthcare Research and Quality, 162,000 Americans die every year from loneliness. And I'm talking about 20 years before the COVID hit us. And that is more than the number of deaths secondary to lung cancer or stroke. In the next slide, I will talk about why these loneliness deaths are there. And it's not merely a health issue, it's also a business issue. In the UK, 2 years ago, the Prime Minister Theresa May appointed a new Minister of Loneliness because they were concerned that the businesses were losing billions of pounds because of loneliness of workers. The prevalence of loneliness has doubled in the last few decades. Loneliness is a personality trait. And like all traits, it is partly inherited. There was a large study of GWAS, Genome-Wide Association study in the UK, about 500,000 people. And they found that loneliness is modestly heritable, about 50%. And that actually applies to most personality traits. They're about 50% heritable, which means that 50% of these traits are determined by environment and behavior. What is worrisome is that the genes that predispose to loneliness also predispose to cardiovascular diseases like heart disease and hypertension, metabolic diseases like diabetes, obesity, metabolic syndrome, and psychiatric disorders, major depression, generalized anxiety disorder, and Alzheimer's disease, as well as other dementia. So you'll see a bunch of disorders here that are potentially fatal, whose risk is increased significantly by loneliness. Suicides, the rate of suicide has increased in the US by 33% in just 2 decades, from 1999 through 2017. They have increased in both men and women. And what is worrisome is that there is a bigger increase in younger age groups, in teenagers, even as young as 10-year-olds. Opioid abuse related deaths have increased even more so. They have increased more than 6-fold. In 1999, 8,000 people died of opioid related death. Today, that number is 50,000. And it is loneliness that underlies both suicidal behavior and opioid use. As a result of this, the average lifespan declined in the US from 2015 through 2017. That's really incredible because the lifespan has been increasing continuously since the mid 1950s because of modern medicine, better living standard, and so on. And yet it dropped 2 years in a row, not because of some new cancer, not because of COVID. Was not there until 2020. It dropped because of loneliness, suicides, opioid use, and these modern behavioral pandemics. The good news about loneliness is that wisdom may be an antidote or vaccine for loneliness. And I will come back to that point a little later. Let me just talk to you first about what wisdom is. So, wisdom is a unique personality trait. Why did I study wisdom? So, about 15 years ago, I was appointed director of Institute for Research on Aging at UC San Diego. The previous directors of this institute were internists and they focused on Alzheimer's disease and cancer. When I became director, I thought we should do something different. We should study something that other people are not studying, which is successful aging. What are the things that get better with aging? Everybody knows the things that become worse with aging, right? But are there things that improve with aging? So what could those things be? So being brought up in India, our cultural tendency is to believe that we respect older people and think that older people are wiser. So is that really true? Is there scientific evidence that wisdom increases with aging? So that's how we started studying wisdom. So the first thing you do when you start a study of anything is to look at the literature. You want to find out what is out there. The literature in wisdom starts with almost the beginning of humanity because wisdom has been described in practically all the religions and all the philosophies. And as we all know, Gita is really the compendium on wisdom for life. So I thought that it would be a good thing to start in terms of looking at wisdom in the Gita. Question is, how do you study wisdom in the Gita? We did a quantitative, qualitative mixed method study. We had a medical anthropologist as a consultant. So Ipsit Vahia, who was the grandson of my mentor, Dr. N.S. Vahia, he was my fellow at that time. And neither of us knew Sanskrit too well. So we had to rely on the English translations of Gita. We used two translations, one by a Western scholar, one by an Indian scholar. And we looked at the online versions of this because then we could use some of the software like Textalizer and NVivo to find out how many times certain words were used and importantly in what context. So what we did was we wanted to look at the context in which the word wisdom or its opposite, which is foolishness, were used. And I will give you examples of that in the next few slides. There are many verses in the Gita that talk about compassion and sacrifice. For example, this one verse says, steadfast in the yoga of wisdom, restrained and open-handed performing sacrifice. So sacrifice for the sake of sacrifice, not for the material rewards, not giving donations for getting a tax break, right? Helping others, acts of kindness, charity. And throughout Gita, this empathy, compassion are strongly stressed. And that is actually true for most religions. Emotional regulation. Again, there are a number of verses in the Gita which are like this: anger, desire, the wise man's eternal foe. By this is wisdom overcast. So the Gita suggests that we should not have extreme negative or extreme positive emotions. At the same time, contentedness is fine. Satisfaction with a job well done is appropriate. So there is more positive side, but definitely not extremes. Self-reflection, ability to look inwards. And in Gita, usually that means humility. So this one verse says, for example, let him, that is a wise man, give up all thoughts of I, force, pride. So humility and lack of narcissism means awareness of one's own limitations, including mortality and relative unimportance in the broader realm of the universe at large. Wise man, by definition, is non-narcissistic. Socrates said that anybody who thinks he is wise is not a wise person. Because if you are wise, you know how much you don't know, right? Decisiveness. I mean, this is the whole Gita really is based on that. Lord Krishna is telling Arjuna to shed aside his doubt and take the sword and fight the enemies of the people, even though they were related to him. So take up this sword of wisdom, cut this doubt of thine, unwisdom child lurking in thy heart, prepare for action, stand up. So steady thought, lack of ambivalence, but of course it is different from delusional self-conviction. And of course, spirituality, religiosity, the whole Gita is a religious document and says, let him, that is a wise man, sit intent on me, that is the God. And meditation and spiritual exercises are stress. Gita also talks of levels of wisdom. So at one level, so there is no wisdom or even on the negative side. So these are the sociopaths. These are people who indulge in devilish ways. They are out there to hurt other people. Then there are others who they don't hurt others, but they don't help others either. So these are people who have low level of wisdom. So they're selfish. They're not antisocial, but selfish. Then comes moderate level in which people are good. They go out and help others to some extent. But the highest level is yogi, where one gives up all the belongings and sacrifices everything for the sake of others. And importantly, Gita believes in teaching wisdom. In a way, I mean, otherwise, why would Lord Krishna teach wisdom to Arjuna and through that to actually the whole population? So the underlying concept is that wisdom can be taught and learned. One can improve. So you can upgrade your level of wisdom. If you are low level, you can go to medium level and then to high level. And the Gita says that anybody can do that. For whosoever makes me God, so is heaven. So whether it is, so whatever caste, sex, race they belong to, they can still become wiser. So this is Gita. So as I said, this whole thing started because we wanted to find out how wisdom was defined in the literature. So we started with the oldest literature, which is the scripture. Then we wanted to move to empirical literature. Now, wisdom has been around, as I said, in religions and philosophies for centuries. But scientific research on wisdom started in the 1970s. The first papers on wisdom came from Max Planck Institute in Berlin and University of Southern California in Los Angeles by Paul Baltes and Vivian Clayton. Since then, the number of papers on wisdom has been growing rapidly. In the last decade, last 10 years, that is from 2010 through 2019, there were 2,000 papers peer-reviewed that you can find on PubMed that had wisdom in their title or the keyword. So the literature has been growing. So we found, though, about 25 well-done empirical studies that had used a definition of wisdom. So we wanted to find out what were the common elements to the definition in those 25 articles. And then we also established a panel of international experts on wisdom and asked them how they define wisdom. We used a method called Delphi or RAND panel. So 3 approaches we took to defining wisdom. Wisdom in the scriptures, modern empirical literature, and expert consensus. We thought that we would probably get different definitions because wisdom is a cultural concept. It would vary time to time, culture to culture. We were very surprised to find that it did not. We found that the concept of wisdom in the scripture and the one that is there in today's empirical literature is almost identical. Not exactly identical. For example, Gita is clearly much more religious than the modern definitions are. And also it emphasizes lack of materialism, which does not figure prominently in modern definitions. Nonetheless, the commonalities are striking. What are the commonalities? Pro-social behaviors, empathy, compassion, altruism, sacrifice, emotional regulation. I talked about that, emotional regulation in the Gita with some positivity though. Self-reflection, ability to look inward, try to understand yourself. Of course, in Gita, it means more humility. Accepting uncertainty and diversity. This is probably more prominent in the Western literature, but the fact that we need to be accepting of diversity of perspectives, that I may have strong values, but I can understand why somebody else may have different values. That doesn't mean that one of us is evil or dumb. No, I mean, we all can be reasonable and yet have different values. And at the same time, decisiveness is critical. The whole Gita is based on decisiveness, and that's also important component of modern definition. And lastly, spirituality. This is one of the weaker components of wisdom according to the modern Western definitions. It is included, it is definitely not religiosity, but it's spirituality, which means connectedness with something or someone, connectedness with soul, consciousness, nature, God, however you define it. But the point I want to make is that the basic definition of wisdom, the component, has not changed. The next question is, how do you measure it? So there have been several scales for measuring wisdom, just like scales for measuring different personality traits, like loneliness, resilience, and so on. So typically the scales include a bunch of statements about your behavior, and then you say whether you agree or disagree. So we developed the San Diego Wisdom Scale, or SDWISE. It has 28 items. There are 7 components of wisdom, and we have 4 items for each of them. It has good to excellent psychometric properties. By the way, if you are interested in using the scale, you can do that easily. Go to our website, aging.ucst.edu, and look for the scale. It'll be there. You can complete the scale and you'll get a score on each of the components as well as the total score. So examples of the items are, it is important that I understand the reasons for my actions. So that is looking at self-reflection. Another is I have trouble thinking clearly when I'm upset. So that suggests absence of emotional regulation. When you're upset, you can't really think logically, right? So there are some items that are positively worded, some are negatively worded. Again, most good scales do that. People often confuse wisdom with intelligence. Wisdom is not intelligence. Intelligence is necessary, but not sufficient for wisdom. People who have clearly some kind of intelligence and cognition are essential for wisdom, but IQ does not correlate with level of wisdom. There are some very smart people with high IQ who are antisocial. Some of the terrorists actually have high IQ, and yet nobody would call them wise because they're so antisocial. Same thing about social intelligence, emotional intelligence. They're part of wisdom, but wisdom is much more than any of them. So my interest as a physician and more as a neuroscience researcher was to find out the brain basis of wisdom. Where is all personality traits are based in the brain, right? And mind is a function of brain. So the question is, where in the brain would this be located? How do you even begin to find that? So what we did was, we started first by doing a Google search for neurobiology of wisdom. How many articles did we find? Zero, because most of the neurobiologists don't use the word wisdom. So we looked at neurobiology of components of wisdom, like, or their opposite. For example, neurobiology of empathy, neurobiology of compassion, neurobiology of antisocial personality. And we found lots of articles with fMRI, PET scans, SPECT, EEG, neurochemistry, neuropathology, bunch of articles actually on these. And we found that some brain regions were represented in all of these components. Prefrontal cortex or limbic striatum. But then that was reflecting on the individual components, not the wisdom overall. So what we wanted to do was look at people whose personality and behavior change radically from wise to unwise following a localized brain injury or localized brain disease. So we wanted to find out if there were examples of that. One of the most famous examples of this kind is Phineas Gage. Phineas Gage was a construction worker in Vermont in the mid-19th century. Young man who was smart, nice, helpful. He was a wise person. One day there was a big explosion and a huge iron rod went through his skull and damaged part of his brain. After that, he survived. He was fine, except that his personality changed radically. This is his description by his physician. He became fitful, irreverent, profane, impatient, obstinate, capricious, vacillating, childish, passionate. His mind was so radically changed that friends said he was no longer Gage. So this is exactly going from wise to unwise. And where was the damage? It was localized to his prefrontal cortex. And how do we know that? His skull had been preserved. And this neuroscientist at UCLA, Dementia and colleagues, they published a paper in Science describing where the damage was. And there have been a dozen such cases reported since then. It's exactly same symptom and same level of, same site of damage. There's a disease called frontotemporal dementia. And there's a behavioral variant, and these are the symptoms. Poor social decision-making, loss of personal social awareness, disinhibition, impulsivity, sociopathy, lack of empathy, emotional coldness, apathy, lack of insight, self-centeredness, exact opposite of wisdom, right? Where is the damage? As the name suggests, anterior part of the brain, prefrontal cortex, and part of the temporal lobe. So based on all this, we published a paper on neurobiology of wisdom in the Archives of General Psychiatry. And we reported that the main areas of the brain that are involved are prefrontal cortex, dorsolateral, ventromedial, and anterior cingulate, insula, and limbic striatum, especially amygdala. So that's about wisdom as a trait which is biologically based. I mean, obviously, that doesn't mean it is not affected by social and society and culture. Of course it is, but still, there's more biology there. So the next question, as I said, the whole work started out of desiring wisdom increases with aging. There are a number of cross-sectional studies in the literature that have shown that older people have higher levels of some abilities than younger people. These include emotional regulation, positivity, that is favoring positive emotions and positive memories, empathy and compassion, self-reflection, and decisions that require experience because experience comes with age. I mean, you'll recall that these are all components of wisdom, right? Emotional regulation, positivity, empathy, compassion, self-reflection, decisiveness. So number of studies have shown that older people, and actually if we think about ourselves, after a certain age and with aging, we all have greater control over our emotions. We become less negative and more positive. We become more compassionate. We become more self-reflective. We make better social decisions, right? I mean, we all would agree with that. Of course, there are exceptions. There are older people who are very unwise, and there are young people who are wise. But by and large, wisdom seems to increase with aging. And wisdom of aging actually may be much more valuable and important than that. If you think about Darwin's hypothesis of survival of the fittest, what Darwin said was that animals will not live after they lose the fertility, because when you lose a fertility, you can't reproduce. That means you can't contribute to the species survival. The species needs so many animals, right? And when you don't reproduce, you are no good for the species. And that's what happens in most vertebrates. They die soon after losing fertility. Not humans. The average lifespan today is 80. It will soon be 90. So if somebody lives to 90, that means we spend half of our lifespan after menopause in women or andropause in men. So we live half of the lifetime without contributing to species survival. And on top of that, our physical health declines. That doesn't make sense, does it? Unless something improves with aging. And so the question then was, is it wisdom that improves with aging? Wisdom that may improve with aging that compensates for loss of fertility. How is that possible? There is something called grandmother hypothesis of wisdom. So these are grandparents. And again, of course, the grandmother is more important because the mother is the one who gives childbirth. So when there's an adult daughter, so the grandparents, especially grandma, is involved in helping the adult daughter raise children. What happens? The adult daughter becomes happier, lives longer, and produces more children than the grandma did. So the grandma cannot reproduce after menopause, but she's helping her daughter live longer, be happier, and produce more children. So the grandma is helping species survival, not by reproducing herself, but helping the younger generations be more fertile, more happy, and with greater longevity. That is the grandmother hypothesis of wisdom. And this has been shown in dolphins, whales, birds, and humans. And these are papers published in journals like Nature and Science. So this is really hardcore science, not just some feel-good TV science that we see everywhere. My colleagues at UCSD have described what they call grandparent genes. Variants of two genes, CD33 and ApoE, that allow better functioning heart and brain in old age are the CD33 and ApoE. So if you have these variants, you will live longer and be capable of grandparenting. Studies have shown actually that the grandparenting has positive impact on grandchildren in other ways also. This was a large study in UK, about 1,500 secondary school students aged 11 to 16. They found that when grandparents were involved in raising the kids, these grandkids had fewer emotional problems, more pro-social behaviors like empathy and compassion, and fewer adjustment difficulties than kids who didn't have grandparent involvement. And this was especially true among teenagers from single parent and step parent families. These are the families where the children need better care or greater care, right? So, and the number of other studies actually have reported something similar. So grandparenting is useful for the kids. It is also useful for older people. Very nice study, large study done at Johns Hopkins, funded by MacArthur Foundation. It is called Experience Score. This was a randomized controlled trial. What the researchers did was they recruited some older people who had retired from their jobs. And one group had to agree to spend 15 hours a week in elementary public school for one full year, okay? 15 hours a week for 1 year. And the other group didn't do that. They found after 1 year, of course, that the kids' grades went through the roof and the kids were very happy. With older people, their mental and physical health improved, biomarkers of stress and aging in blood and urine improved. And take a look at this. the volume of hippocampus on brain MRI was larger at the end of the study in people who participated in teaching this or helping this public elementary school kids compared to those who did not. Now, that doesn't mean that the volume of hippocampus increased. What it means is that the volume of hippocampus did not decline with age in older people who helped these younger kids. So clearly, this intergenerational activity is a win-win situation for both the generations. So when I went to medical school, I was taught that the only thing that happens to brain with aging is that it shrinks. It loses neurons, synapses, blood vessels, everything. So how can anything get better with aging? I talked about the abilities that improve with aging. How is that possible? Well, one of the most important discoveries in the last 3 decades is that of neuroplasticity of aging. Studies showing that the brain continues to be plastic. That means it continues to evolve in older age in people who stay active. That is critical. That if is important. People who stay active physically, cognitively, mentally, socially. In those people, there is greater recruitment and more efficient utilization of neuronal networks. Formation of new synapses and even new neurons in selected subcortical brain regions. This has been shown up in a bunch of animal species and in humans. So that would explain why certain abilities would improve. But how do you explain emotional regulation with positivity? Again, several studies using functional MRI and PET scan have shown that the amygdala in later life becomes less active with negative emotional stimuli or regret or fear compared to younger people. So with aging, the amygdala activation does not change in response to positive stimuli, but it changes in response to stressful or negative stimuli. Older people react less to negative stimuli than younger people. And there's a biological basis for that. Of course, there's a caveat, which is that cognitive decline, when it starts, and that may start at different ages in different people, may start at 80, 85, 90, afterward. Once that takes over, then of course, then wisdom cannot continue to increase. But till that time, it can continue to increase in people who are active. Just one slide about wisdom and sex. So this is a study, we haven't actually published it, so don't quote it yet. We'll be submitting this soon. We used a scale for wisdom that measures 3 dimensions: cognitive, reflective, and affective. Affective is also called compassionate because that measures compassion. So the pink bar show women and the blue bar show men, and taller the bar, that means higher the level. So there's no difference between men and women on cognitive and reflective dimension. But on affective or compassionate dimension, there is a significant difference. Women score higher than men, and overall also, women score somewhat higher than men. So why are we talking about all this? As I mentioned this, I just published a book called Wiser that talks about different underlying neurobiological basis, as well as how one can increase the level of wisdom. Physical and mental activities improve brain functioning. That is a well-established phenomenon. Mindfulness and meditation. Number of studies have shown that they have biological effect. One study found that it reduced the expression of pro-inflammatory genes, and it increased the activity of telomere, the enzyme that increases the lifespan of a cell, and increase white matter integrity. So meditation, mindfulness, these are not psychosocial interventions. They are biological interventions. And that applies to a bunch of other similar interventions too. The good news, as I was mentioning earlier about loneliness, is that wisdom might be an antidote or vaccine for loneliness. One of the most consistent findings in our studies of loneliness is strong inverse correlation between the two. This was a study of about 2,800 people from across the country, across the lifespan. On the horizontal axis, you see wisdom. On the vertical axis, you see loneliness. And people who have high scores on wisdom are not lonely, and vice versa. And we just completed a longitudinal study that shows that people who have high scores on wisdom are much less likely to be lonely 7 years later. So it is not just cross-sectional, but even longitudinal data support that increase in wisdom can reduce loneliness. Of course, the question is, can we increase wisdom? The answer is absolutely yes. Like loneliness, most traits are only partially inherited, about 50%, which means that 50% of each trait is determined by environment and behavior. Wisdom may increase with aging, experience, and learning. And we saw that wisdom is reduced by a specific kind of brain trauma or brain disease. So if wisdom can go down because of damage to certain areas, can it not increase by stimulation of those areas? Right? I mean, it should. Right now, we don't have answer to that question because the neuroscience has not developed enough to be able to stimulate specific areas that very specifically and precisely. But that will happen. So how can we increase wisdom? Right now, the interventions are psychosocial, behavioral. And those are the ones I'll be talking about. But in future, I fully expect there will be pharmacological intervention. Drugs, which would include emotional regulation, for example. Already there are drugs for ADHD, which reduce impulsivity. Biological, things like RTMS, repetitive transcranial magnetic stimulation, could cause actually stimulation of deeper areas in future, and technological too. So are there actually studies to show that wisdom components increase? And again, the answer is resoundingly yes. We just published a paper in JAMA Psychiatry. This was a meta-analysis of 57 randomized controlled trials that sought to increase one of the components of wisdom: empathy, compassion, emotional regulation, or spirituality. And these were studies done in people with mental illnesses, physical illnesses, and those from the general population. Half of these studies reported significant enhancement of the component with moderate to large effect sizes. So that means that there are interventions available today that can increase empathy, compassion, emotional regulation, or spirituality, at least in some people. Not in everybody, but in some people. So I'm coming to the end of my talk. So this is all fine, but what do we do in our everyday life? How does it help us? How do we become wiser, and how do we help our patients become wiser? So practical wisdom is really forming a habit of making wise decisions in everyday life. And this doesn't apply only to huge decisions, big decisions, even smaller decisions. And what is a wise decision? Something that involves self-reflection, emotional regulation with positivity, empathy, compassion, decisiveness, uncertainty, and spirituality. So all the components of wisdom. You know, this sounds really difficult, but once we start making a habit, it is not. So how do we make such a habit? The first thing is to do honest self-reflection. None of us, or at least I would say most of us, are not strong in all the components of wisdom. But most of us are not weak in all components of wisdom either. We all have certain strengths and some limitations. So where are we strong and where we are not? So if you complete our San Diego Wisdom Scale, as I said, you can get it on our website, aging.ucst.edu. It'll give you scores. And again, you know, one scale doesn't mean everything, but at least it gives you an idea about your relative strengths and weaknesses. And then once we find where we need help, there are interventions for each of those components available. I'm just going to give you a couple of examples, and that's it. Emotional regulation. In California, road rage is an everyday thing, right? And that's totally understandable. I think all of us have experienced that. I'm getting late to work in the morning and somebody cuts in front of me. I'm so upset, so mad. I start shouting, screaming, cursing, whatever. Uh, that's not going to help me. I mean, the risk is that actually I may have an accident and that'll make everything worse. So how do I control that? So one is cognitive reappraisal or rationalization. Make a deliberate effort to reinterpret the meaning of that event. Why did that person cut in front of me? Not necessarily because he was a jerk, he may be, but one possibility is that there's a child in the back seat of that car, and suddenly the child threw up or the child had a seizure. What would you do if you were if you were the driver? Would you not cut in front of others just to go to the emergency room? Right? Another strategy is distraction. Change the focus. Don't think about that person. If you are listening to, I usually listen to Bhimsen or Bollywood songs, and I can increase the volume of that radio at that time. Or third is labeling. Recognize the fact that you are angry. It is absolutely okay to be angry and move on. Empathy, compassion. This is something I want to show because this has actually social relevance. This is a study done in Spain, 176 teenagers, okay? They developed Cyber Program 2.0 to prevent bullying and cyberbullying. Again, this was a randomized controlled trial. It included 19 group sessions, 1 hour each. And they included the elements of intervention were role play, brainstorming, case study, guided discussions. They found that the Cyber Program 2.0 compared to controls increased empathy and compassion. It reduced the amount of bullying and cyberbullying compared to the control condition. One study again doesn't prove everything. However, just think about that if we can do something that would reduce bullying and cyberbullying at a large level, how many lives it will save and improve. Because bullying is such a major problem, and the social media, cyberbullying has become sometimes lethal. People have committed suicide because of that. So what we need is really education. I talked about this modern behavioral pandemic of loneliness. How do we control that? We need a vaccine of a different kind, behavioral vaccine. And that is where I think wisdom can come into play. And I think what we need to do is change our education system everywhere, starting from K to 12 to medical school, engineering, law school, businesses. Currently, the society focuses on IQ and it focuses on hard skills. In the medical school, we teach the medical students to be the best diagnostician, the best sub-specialist, right? Best therapy prescriber. And that's wonderful. I mean, obviously, that's why we become physicians. But is that enough? We need something more than that. We need soft skills. We need self-reflection, empathy, compassion, emotional regulation. Nobody teaches those things. In the schools, we now have actually physical education classes. We have arts classes. We even have sex education. Now there is increased emphasis on diversity. These are all great. How about having classes to improve self-reflection, compassion, emotional regulation? If we did that, just that cyberbullying intervention should, I think we can make significant improvement in people's lives. And again, for us as physicians, this is important because suicides and drug abuse are increasing among physicians and medical students. And we need to do something. They're so stressed out, burnt out, lonely, that we need something at the societal level, this kind. And if we did that, when you go from 2020 to 2021, we'll not only go from fear to being wiser, but we can actually begin to transform today's lonely, distressed, polarized world where people just don't dislike each other, they hate each other. And there's violence. We need to change that into a happier, healthier, and wiser society. And we can do that. Thank you all for your attention. And I'll be happy to take any questions.
That was a great talk, Dr. Jeste, and you touched a lot of topics that are of relevance to us, moving from a time of pandemic that's affecting the whole globe, as well as at the individual level, as well as the societal level, national level, and the global level. And you touched on a lot of things. That there were some questions. Maybe let's start with the questions first. Let me pose the first question. Actually, you talked about the physician suicide. At least 350 to 400 physicians are committing suicide every year, which is like losing 2 classes of medical graduates every year. So can you talk a little bit about it? What kind of interventions organized medicine is doing to kind of address this issue, physician burnout or moral injury that we are suffering?
Yes, actually, number of medical schools are now beginning to have wellness clinics and help. But at UC San Diego, actually, we got some large endowment for Institute on Empathy. And a major part of that focus of that institute is medical student training. So we are doing some research, but also actually implementing some compassion training classes for medical students. The goal is to practice, sort of teach about what is compassion. And there are ways in which this can be done. There are interventions that include things like role play, keeping a gratitude diary before you go to bed. Write a couple of things that made you feel grateful to somebody, because that makes you then feel wanting to do something for other people. Similarly, things like try to be in a wheelchair for one full day, and you will understand what the person in a wheelchair feels like. So experiencing those things really helps. And these kinds of classes are now becoming more common. They're not yet, I think, there, but we really need to change that, because the stress level among the medical students is very high. The stress level among physicians, the burnout among physicians is very high. And really, we need to do something along that line. So it is beginning, but actually, clearly, we need to do much more than that.
Thank you. Dr. Vasavada, you want to pose the next question?
Yeah, I think I have my personal question. Dr. Jeste, how can you define a loneliness? Because can there be some people, like from your graph, which suggests that there are some wise people who are lonely, but they're wise. So somehow they can manage their time and their anxiety of being lonely very well. So is that some kind of medium that some people find it?
No, that's a great question. Loneliness is subjective. So whereas so loneliness and social isolation, they're related but different. Social isolation is objective. It measures how many. So if I have 5 friends and you have 10 friends, then I'm more socially isolated than you are, right? Loneliness is different. Loneliness is a subjective feeling of distress because of lack of company. So being alone is fine. So being alone actually is often great, because actually you get time for yourself. You can read, you can think creatively, you can do something. Except that for people who are lonely, that becomes very distressing. So they feel that they are alone because they have failed to have social connections. And they blame themselves for that, and they keep them distressed. So it is not being alone that is a problem. It is feeling distressed by being alone that is a problem. So the wise people who are lonely, so wise people are alone, but they don't feel lonely. That's the difference.
Right.
Okay,
When you choose to be alone, that's your choice, and that actually promotes self-reflection, whereas loneliness is when imposed on you due to physical or some social determinants that can be an illness or a cause of illness.
Okay, Ravi, can I take the next question together? There are 2 questions here.
Yeah,
And
go ahead.
I can combine that. One question was that, are there any organizations that support the wisdom or somehow incentivize it? And then another question is that, are there any online courses that one can take to increase the compassion or wisdom?
Yeah, these are both great questions. This is something we hope will happen. Um, right now, what is happening is I think people have begun to appreciate the importance of well-being and happiness. Even for NIH, the outcome measure used to be pure physically, objectively measured health and biomarkers. Now people are realizing that well-being and happiness is the important outcome. Similarly, for healthcare system, patient satisfaction is important, not just some objective measure. And
So
with
the
that in
point
mind,
is the corporations and organizations also are getting wise along with the
correct.
individuals.
Right, right. No, I think because businesses, as I said, in UK, they have a minister of loneliness because the businesses were losing millions and billions of pounds because of loneliness of the workers.
Right.
So you want people to be active and productive. So you can't let them be stressed out, lonely, and burnt out, right? So I think this is beginning to happen. But we need to make it happen. And I think here, as physicians and psychiatrists, we can actually play a major role in that. Because if we don't, who else will, right? I mean, so that's why I think the more we can do in terms of talking to media and um, politicians and other policymakers, the more useful it will be.
Okay, I have a question. If you remember Dr. Jeste, you probably might have met Dr. Valant. When I was a resident, I was reading his book, Aging Well. That was about 30 years back. He was the second director for Harvard study on that studied 50 years. The cohort studied for 50 years. And he wrote the book, Aging Well. And his follower, Dr. Waldinger, was the next director for the Harvard study. He also talked about loneliness, relationship, empathy. So these are the concepts that have been played around, but they're getting the major press right now. So can you shed some light on Harvard study and the research findings?
Yeah, sure. As I said, wisdom has been around since the beginning of the humanity, but
Right.
empirical research started in the 1970s. And as I said, the number of papers has been growing. However, most of the research is being done by gerontologists, sociologists, and psychologists, not by physicians and not by neuroscientists. George Valiant at Harvard was actually an exception. He was really pioneer in starting this study and following people. Of course, these Harvard undergraduates, it's a highly select sample, but nonetheless, even in that, he really did a great job in following these people for decades and seeing how the certain traits increase and some do not. Um, of course, they were all men. Again, this was starting a long time back, so when they didn't. Uh, but I think it's really important that there be research, including research from. So there's actually a large wisdom conference that, not large, sort of mid-sized conference that takes place usually. I'm the only MD and only person actually involved in sort of working with the brain there. So I really think we need to get psychiatrists, other physicians and neuroscientists need to get more involved to uh, make this a real science.
Okay, I have a question here by Dr. Sunita Polepalli. When you don't have like a genetically related grandmother, can a nanny or a babysitter play the same role as far as transferring the wisdom or the abilities to the child and the child rearing?
But thank you for asking that question, because when I say grandparenting, I don't mean literally biological grandparent. No, it's just older adults. And as I talked about that experience score study at Johns Hopkins, where these older adults helped the kids in public elementary schools. Yeah, so nanny and often older nannies are great. Uh,
Right.
so anything we can do, and again, it's useful for older people too. I think one of the problems I think in our society because of ageism is that we assume that older people are not useful for anything. They can't do their job. That's why they are forced to retire, and then they can't make any decisions, right? That is so wrong. That is so wrong. I think we should help older people stay active and help the younger generations. I think it'll be a win-win situation.
Can I ask you another question on the same line, Dilip bhai? I think I see a lot of grandparents who are thrust into a primary parent role. They're like 60, 64, 65, and suddenly they have 2, 3, kids to take care of it. And I think at that point, somehow they lose their wisdom. They do try to do their best. Some do good, some don't. But I think it's good to be a grandparent in a sense, like you say. It's like it's not your child. You can just come in and do the thing what you need to do, provide some wise statements and leave the area. But when you're primary parents, I think it's very hard to remain wise.
Right. I think grandparent actually, that grandmother hypothesis, if you remember, it meant helping the children's parents. And so you help your adult daughter to raise her children. And that helps both the daughter and the children. What happens is sometimes older people, again, it depends on their age and their cognitive ability. If there is fairly serious cognitive impairment, which can occur, at different ages in different people, then obviously they will not be able to do the grandparenting. So clearly you need to make sure that the grandparents are still capable of doing that. But when their cognitive functioning is at a high level, or at least normal level, and they are active, they should be very useful grandparents. Again, as I
Let
said,
me combine. Can I
go ahead.
combine a couple of questions? Dr. Malapati asked about commenting on meditation, and another question was about laughing out loud. I guess laughter therapy, is it of any value for wisdom?
Well, so regarding meditation, yes, there is actually a lot of literature right now, a number of very well done studies. So meditation is now an accepted treatment, no question about that, and it has even biological effects, as I said. Regarding laughter therapy, some definitions of wisdom include a sense of humor. And there is no question that humor helps. However, the type of humor is important. Humor that is sarcastic or cynical or which makes fun of people is not useful. Laughing at somebody is not useful. Laughing with somebody is useful. So laughing out loud is great because it relieves the tension, but it should be not at the cost of anybody else.
Right. So that was a great presentation. Dr. Basava, do you have any other questions you want to bring up?
I think you covered that. There are a couple more questions here. One is about does the age or material success play a role in gaining wisdom? Or maybe it's vice versa, I'm not sure.
So material success, whether it helps wisdom, was that the question?
Yeah.
Okay, so I think it depends. It depends on the experience. After a disaster, typically, many people will develop PTSD. There are some people, though, who will actually grow from that. So there is something called post-traumatic growth. So same experience, the crisis, disaster. Some people develop PTSD, some people develop post-traumatic growth. So same thing will happen with success. If you win a lottery or if you do very well and you're lucky, and then whatever invention you have makes millions of dollars. Some people will learn from that and they will become wiser. Other people, though, for them, it could be a negative expectation and experience. And that's why sometimes you see people who are highly successful at a young age, and then they go down after that. So it is not the experience itself, it's what you do with the experience is what determines your success.
Yeah, Nicomachean Ethics by Aristotle wrote about it. Happiness has many components. One is material wealth and a powerful position or pleasurable, like a sensual pleasures, but they're not ultimate happiness providers. Its happiness comes from wisdom, and that's why our constitution has this pursuit of happiness is not just about material wealth or a powerful political position or a pleasurable lifestyle, but contributing and caring for each other. All those wisdom concepts are very important.
That's exactly right. So there's a difference between hedonic well-being and eudaimonic well-being.
Right.
Hedonic, because the problem with hedonic is that if I'm looking for $1,000. If I get 1,000, then I'm not happy that I want 2,000, 10,000. So it is called hedonic treadmill.
Right.
So that's why sort of this, what Gita also stresses is eudaimonic well-being.
Yeah, that's another Aristotelian concept, eudaimonic happiness rather than hedonic happiness. So Dr. Jeste has been the proponent of positive psychiatry, and he has studied and researched and promoted the concepts widely. So we are the beneficiaries of his wisdom today. So I hope all of you have a happy holidays. Like we say, happy means not just comes out of all the gifts we are getting, but all the wisdom we are sharing today and sharing along with each other. So have a wise holiday and wise New Year, as well as happy holidays and happy New Year. Thank you very much.
Thank you. Thank you,
Dr.
Dr.
Jeste.
Jeste. I really like to thank you for your presentation, taking your time for doing this.
Thank
Tarek,
you.
go ahead and thank
you. Happy New Year, everybody.
Happy New Year
Yeah.
and stay safe, and thank you for joining us.
Good night.